Unpopular hospice opinion. Okay. Hospice is not a service that should be used to bridge a patient or individual that lives, independently or in assisted living, um, to keep them there, right? So, example I would use is, you have someone who lives independently or in assisted living, they're having more falls, they need help with transfers, they're declining, but it's not necessarily like they're 6 months or less of life declining. They're just functionally declining, demonstrating that they need more assistance, whether that's moving from independent living to assisted living, or that's moving from, assisted living into a long-term care facility. What I find in these scenarios and why I bring this up is just that oftentimes in these situations, in my experience, the patient's goals of care, wishes are not necessarily aligned with hospice to begin with. What does that mean? That the patient, their family, they want to continue to seek specialty care, right? They still want to go to the ER. They still want aggressive measures done. But we're just using, hospice as a extra layer of care to keep them in the facility they're placed in. And that, in all of that, right, it just creates a problem, right? Number one, their wishes are not aligned. Number two, you know there are criteria that someone needs to demonstrate that their life is going to end in 6 months or less. As a hospice advocate, I know that people who go on hospice often live longer because you get them off of meds, they get some extra care, but they're still declining, but their needs are met. You know what I mean? I hope I'm saying that right. Anyhow, I just wanted to bring that up because it is something that I see, and it's something I even experienced as a hospice nurse, having to go out and evaluate people who really, again, weren't appropriate for hospice. They just needed a higher level of care, but whether that was the facility, whether that was the patient, whether that was their family, they just weren't accepting of it. What are your thoughts on situations like this? Have you run into it? Um, how do you go about educating patients, their families, facilities, if this comes up?